I think all of us who do this work, subspecialty treatment of anxiety and depression and related conditions, all of us struggle with the patients where we feel like our usual regimen of weekly or possibly even twice weekly treatment isn't going to be enough. I have many patients in my history where I wish I had more time, and I wish I had an opportunity for somebody to get comprehensive services in the same place, psychiatry, psychology, behavioral technicians who can provide as much exposure as we can get. And so those of us who do this, we have in our minds the 25% of patients who don't respond to the weekly regimen that we do. And if you add that up over the course of, especially in our region, we're talking about thousands and thousands of patients. And so for me, having a place where I could send people confidently, where Roger's 20 plus years of experience in doing this and the behavioral framework of the treatment for anxiety and related conditions could be welded together and get me a place where I can get subspecialty services, multidisciplinary services, I think that would be a huge contribution. And I know from my travels, I do a lot of training, I know a lot of questions I get at these trainings, what happens if the weekly doesn't work? And my answer is, well, we have to send them to subspecialty practices that can provide multidisciplinary, more frequent cases. And then the next question I get is, where can we get such a thing? And my answer is, well, here are the 3 places around the country, and I get these forlorn looks because those places are not in our region. And so now we're in a position to be able to say, we have something in the region that's going to allow us to do what we've all been hoping for, which is to provide a higher dose of CBT, highest quality CBT, and also a multidisciplinary perspective that is really difficult to find in the outpatient setting. And that to me is the most exciting part of this. I think another exciting part is we're putting together expertise, clinical expertise, I think is unrivaled in the world, and we may well be in a position to put our collective heads together and start asking basic questions about psychopathology, research questions, things we can think about that will inform us, will contribute to the knowledge base about OCD and depression and related conditions, and advance the field in a way that we may well be able to help patients more effectively 10 years from now. And these are probably the most severe patients that have ever been evaluated and ever tested and ever possibly researched. So we're going to be in a really unique position to look at the more extreme end of the spectrum in terms of our understanding of how these patients function and how to get them better.